John A. Logan College provides opportunities to obtain degrees and certifications in a variety of programs and fields of study. One program that John A. Logan College is proud to offer is in the medical assisting field. This video will help you to discover a career path in medical assisting and will give you an in-depth look into the medical assisting program at John A. Logan College. Here to provide you with valuable information regarding the medical assisting program is Martha Pebbles, the coordinator and instructor of medical assisting at John A. Logan College.
Hello, I'm Martha Pebbles. I'm the Associate Professor and Program Coordinator for the Medical Assistant Program for John A. Logan College. The Medical Assistant Program is a one-year, two-semester program. Prerequisites include NAD 101, which is Nursing Assistant Training, Keyboarding, Bio 105, which is Anatomy and Physiology, and HIT 217, which is Medical Terminology. The Bio 105 and HIT 217 Medical Terminology can be taken in the fall along with the medical assistant courses. However, it makes for a much easier semester for the student if they can take these courses ahead of time. Also, sometimes these courses are offered dual credit from the high schools, and it's recommended that students take advantage of this. First semester, the classes are Medical Office Procedures, Introduction to Medical Assisting, and Medical Terminology. Classes are Tuesdays and Thursdays, and this allows students the choice to possibly still work full-time or part-time while attending school. Medical Office Procedures is taught in the first semester. This is a course where students learn front office skills, communication skills, both oral and written, electronic technology, bookkeeping procedures, medical records management, billing and coding procedures, and this is a hybrid class with lectures online and labs that are done in class face-to-face. The Introduction to Medical Assisting is an online course. This course is designed to orient the student to the career of being a medical assistant. It includes professionalism, empathy, ethical and legal considerations, and patient education. In this course, students prepare resumes, cover letter, a reference page, and they prepare themselves for mock interviews. Most students report that the interview practice is one of the most helpful aspects of the program. Medical terminology is also taught face-to-face. This course gives knowledge of the basic structure of medical words, and each body system is addressed, along with procedures, diagnostics, and the pathology of each system. Introduction to Electronic Health Records is a hybrid course. The concepts and features of electronic health records are taught. Students learn to navigate a mock system and build skills that will transfer to a variety of systems that they will encounter on the jobs. Many students find this their favorite class of the first semester. Spring semester consists of 4 face-to-face classes. Again, these are taught on Tuesdays and Thursdays. They consist of medical clinical procedures, medical laboratory procedures, pharmacology, and the externship, which is 160 hours of clinical experience in an ambulatory care setting. Medical clinical procedures helps the student learn the back office procedures that are performed in a medical office, such as minor surgeries, diagnostic procedures such as EKGs and spirometry. They are also taught how to assist the provider with performing physical exams, rehab, therapeutic modalities, nutrition, and much more. Medical laboratory procedures, students learn phlebotomy skills and office lab procedures. Many office labs that are done CLIA waived office tests such as urinalysis, strep screens, pregnancy testing, mono testing. Students are taught all of these procedures in the medical lab class, as well as learning phlebotomy skills. Pharmacology, students learn pharmacology theory, also medical classifications, dose calculations, and administration procedures of medication. These include oral, IM, sub-Q, and intradermal. Most students find this course very exciting and they feel ready to use their skills during their externship. Speaking of that, the externship is 160 hours of clinical experience in the ambulatory care setting. The student and I get together and decide where a perfect spot for them to be. Several sites including SIH, Shawnee, SIU Family Practice, Ray Clinic, Pediatrics, LLC, and many more. During this time, students get to practice their skills under the supervision of a site supervisor. And this is by far the most exciting and practical part of the entire year. Students enjoy this very much. Shortly after the student graduates, they take a CMA exam. This is a certification exam that is given here at John A. Logan College. It is given through the NCCT, the National Center for Comprehensive Testing, and it is a national exam. Students can work anywhere in the United States after completion of the exam, and they have to have a 70% pass rate, getting a 70 or better. The exam consists of 150 questions, and there's a 3-hour time limit. John A. Logan College graduates have a 90% pass rate, and we're really proud of that. Jobs are abundant for medical assistants here in Southern Illinois. Some students actually get a job offer before they graduate, sometimes even from their externship site. Graduates report good job satisfaction, and they often go on to further their education in the medical field. Students in the program range from ages 18 through 65. Many of my students are non-traditional who want to return to the workforce in a medical career. Many want to begin their medical career as a CMA and then go on to nursing or other medical fields. Some employers offer tuition reimbursement as well. Now let's hear firsthand from some students that have graduated from John A. Logan's Medical Assistant Program. First, I have Darlene Roper. She was a student who graduated in the year 2015. Hi, Darlene. It was so good to see you.
You too.
Darlene was a student who graduated in 2015, and I come across her the other day in a classroom. She's coming back to take classes, and I'm going to let her tell you about what's been going on since she graduated.
Okay. So, as I entered the program in 2014, it was the best experience. It was a struggle at first, but you gotta adapt to it. But one thing I liked most about the medical assistant program was phlebotomy. And everything that you're going to get in that program, you're going to need for the medical assistant program. So just basically do your work, study, listen to the instructor, and you're going to get great outcome. You're going to become the best you can be as a medical assistant. I learned communication skills. I learned hands-on on outpatient care as well as inpatient care. And most of the time, medical assistance is for ambulatory care, but you're going to learn so much more from the program than what you're expecting to get out of it. I worked as a prompt care, I worked in GI, I worked in internal medicine, now I'm in the ER. I've been working as a medical assistant now for 5 years, and I'm looking now to further my education and get my BS in here in the near future.
That's great. I'm so proud of her. Darlene got the record of the most phlebotomy sticks in her class. I believe it was, 150?
Yes.
150 phlebotomy sticks, and we were so proud of her. They just loved having her at her externship site and in the lab. And I'm proud that she's decided to become a nurse, and she's getting into the LPN program, and then she wants to go on to become a BSN.
Yes. And phlebotomy was my favorite of all. And pharmacology too, because it was hard trying to struggle to learn all the different medications, but you're going to need them. You're going to need to know the medications, the dosage, the calculations. So thank you for being on us and making us learn those medications and those calc doses and everything, because we are going to need them. And that was a great experience right there.
You're welcome.
The whole program was a great experience for me.
Wonderful. I'm so glad I ran into you. Thank you so much.
You are.
In 2020, we graduated 14 students from the Medical Assistant Program. One of those students is here today to talk to us. Her name is Mackenzie Hamoya. Hi Mackenzie, how you doing?
I'm good, how are you?
Good. I spotted Mackenzie the other day walking to class on campus, and she spotted me at the same time, and we flagged each other down. I just wanted to let you know that she's going on to continue her education in the LPN program. She's going to tell us a little bit about that, and also about the things she really liked in the medical assistant program. So what was your favorite part, Mackenzie, of the medical assistant program?
My favorite part was definitely the externship. Once I got to Shawnee OB, they let me do so much. I got to assist with so many different things, like a colposcopy, and I didn't get to do any injections because COVID cut us short, but they let me do assessments on patients and weigh patients and do all the things that we learn in school, and I just thought that was really neat.
Awesome. And they really liked you at Shawnee.
Yeah.
So it was
Yeah, we got along well.
good. We have a lot of good externship sites and good places to work as well.
Yeah.
So what was your favorite part of the classroom, the medical assistant courses?
Blood work.
Blood work?
I think that's everyone's favorite part.
Learning how to do phlebotomy.
Stuff. Yeah.
Okay, great, great. And now tell us a little bit how the medical assistant program prepared you to go on to the LPN program.
So in the LPN program, you don't really get to learn much, like blood work and things like that. You kind of just have to go into it knowing what you're doing. And I could not be more grateful for having this course solely because of that. I mean, we learned so much about lab work and blood work, and kind of gave us the basic idea of maybe not how to start an IV, but what we're doing in that case. And I think that that's amazing. And just learning the basic assessments and soap notes and all the little things that don't seem like much all come together in the end to help you in the next step of your education.
So do you think the medical assistant program will help you prepare for the entrance exam for the LPN program to help your scores?
100%, yes. Because I took the entrance exam before, and at the very beginning of our semester, and I didn't do well on it at all. Pretty sure I told you I knew I wasn't going to get in. And then we were almost done, and I took it again, and here I am. So just got to stay positive and really take all the information from that course.
Great. And are you working somewhere right now, Mackenzie?
Yes, I work in the emergency room. That actually happened in the middle of my externship, which really made my life crazy. But again, I said to them when I started, I don't know if I would have known anything that was going on had I not been in this program. And again, my first day I walked in confident doing blood work, so I think that that was a huge plus. I keep going back to that, but that's something that you do every single day, 100 times a day in the emergency room. And without that, I think that I would have been so scared.
Great. So do you have any advice for possible students that are thinking about becoming a medical assistant?
Stay positive. I know right now is not an easy year. It just seems like we keep getting hit with more things with this pandemic, but Martha is wonderful. The program is wonderful, and it will help you in everything that you do from this point forward.
Right. Well, thank you so much. I appreciate
Thank
you coming in today.
Thank you.
Please contact me, Martha Pebbles, by email at marthapebbles@jalc.edu or by phone 618-985-2828, extension 8368. And if you'd like to come and visit the program, take a tour of the college, I'd be glad to introduce you to the program and to some of my students. And I appreciate your interest in the program. Thank you.
Throughout this video, you had the opportunity to meet Martha Pebbles, instructor and program coordinator for the Medical Assisting Program at John A. Logan College, and to obtain a more in-depth look into the course requirements and expectations of a student within the program. You also had a chance to meet 2 John A. Logan College medical assisting graduates and hear how the medical assisting program at John A. Logan College has helped to shape their careers within the medical field. We hope that you'll consider joining the medical assisting program at John A. Logan College, a school that prides itself in being a diverse learning and teaching community, committed to improving individual life and society through high-quality, accessible educational programs and engaged learning opportunities. With such a strong student and community-focused mission statement, why would you go anywhere else?